Look, of course, PGH is one of the COVID referral centers. Now, the last I read about PGH was, I think, mga mid-June. The PGH was saying na napupuno na yung inyong COVID capacity. I think you have several wards devoted to COVID lang. I think you have 200 beds for COVID. And as of mid-June, malapit na kayong mapuno, at least several wards inyo. How's it going now?
Tumataas, actually, just to correct you, yung na-dedicate namin na COVID beds talaga na nabigay namin sa government, sa DOH, was 130 beds, no? But if we're just going to use those 130 beds, we're beyond that. Kasi ang aming census right now, we have 136 COVID confirmed patients and then about 30 plus patients na COVID suspects. So we're operating for the last 10 days, nasa 150 to 160. So slowly creeping up. Ang highest namin ever was 172. Tonight, we have 167 patients.
Oh, wow.
Okay. But you're saying that's a bit pa below your capacity? I'm sorry, 130 nga pala yung capacity nyo. So you're already above capacity.
We are above capacity if we use the number 130. But we have buffer beds. We try to accommodate these patients. Some of these patients are actually ready to go home. A lot of them are mild already. Some of them are asymptomatic. So in some ways, we're able to transfer them to rooms that are not too demanding of the manpower. But yes, kung 130, we are 100% utilization. But if we use the number 200, just in case we really need those, we're probably roughly about 80% capacity.
Doctor, kung kadadagdagan kayo, kasi sabi ng government 30% of capacity of hospitals should go to COVID cases. Kung padadagdagan at gagawin sa inyong 50%, kaya pa ba ng PGH? Kasi napakarami niyo po rin pasyente for other cases, di ba? Kaya ba ninyo?
Alam mo, parang hindi na namin willing ibigay yung 50% of PGH sa COVID eh.
Yes.
Yung 30% nga, malaking concession yon para ibigay sa COVID. As you know, PGH is really a general hospital and nakikita na natin ang COVID patient namin. Dumadating na sila, nag-lift na yung quarantine, medyo nakakagalaw na yung mga tao at nakikita na namin sila ulit, yung mga inaatake sa puso, yung mga may cancer, mga kailangan ng dialysis, marami sila. So, we have pegged as much as possible, 130 beds. Yan, talagang nakakommit kami dyan sa PGH, mga confirmed COVID. And so, we really need the help of other hospitals. At pati na rin yung sinabi nyo, narinig ko sa inyo, yung mga isolation or quarantine centers, they really have to be active in this decking or facilitating of patients. Kasi, sa PGH, luckily, 80% of our patients are mild to moderate. We have patients who probably about 15 to 20% can be transferred already to the quarantine centers. Doon na lang nila itutuloy yung pagpapagaling. I think the mandate of the quarantine centers is to take care of the asymptomatics to the mild. Siguro yung moderate to severe sa ospital pa rin yan because they do not really have the full capacity, and God forbid something happens to these patients, whether they deteriorate again or baka mamaya magka-problema. Yan medyo kinakabahan yung mga quarantine centers dyan. So really what has to happen is a dedication, sort of like an agreement between a hospital and the quarantine centers so that the quarantine centers will not feel like you're dumping your patients to us and we're not equipped. So para ba ang dapat mangyari, the hospitals will be willing to send some of their doctors sa quarantine center or at least nira-round siguro ng hospital kahit paano para alalayan yung mga quarantine centers. If that's going to happen, then that frees up a lot of beds in the hospital.
Yeah. So who's going to facilitate a memorandum of agreement of sorts, between hospital and quarantine facility? Is that something that has been initiated, in fact, or recommended at the very least?
We have raised this issue to the IATF, we're now trying to have a MOA, and some other hospitals, I think, will be following suit. with the quarantine, let's say PICC or the one in Ninoy Aquino, alam mo, iba kanilang mga mandate. For example, we learned that at PICC, they would like to get patients already what we call in their step down or just really recovering from a hospital. While yun naman palang Ninoy Aquino, the patients that they would like to get are asymptomatics or mildly symptomatic na nag-positive dun sa community. So we have to figure out paano yun kasi but most of our patients obviously are coming from the hospital. So PICC ang malamang napuntahan namin. And we understood their concerns. They want some backup from us kasi yun na nga, dahil siguro undermanned din sila. Tsaka hindi pa rin naman talaga sila sanay na mag-alaga ng mga may COVID.
What does the patient attorney say on it? Just wondering, if I were a patient, do I have a say on whether or not I want to be transferred to a quarantine facility?
That's a very good question. And in fact, yes, that's actually another hurdle that has to be overcome because yung mga pasyente po namin sa PGH, when we tried transferring them to the quarantine center, yung iba po sa kanila tumanggi. Siguro dahil they feel more comfortable, they are in the hospital, that's one. Siguro sanay na sila sa environment and the people that they are with. But it's a matter of explaining and reassuring them that we're not sending them there na baka mapahamak sila. Because talaga may mga ibang pasyente, literally nagbibilang lang ng mga araw, parang wala na silang sakit. But they have to fulfill or that requirement a certain number of